Welcome to the latest update from the OCCS. In this section, I really want to concentrate on two particular issues that we are seeing pop up from time to time as we go through our work here at Varifocals. The two issues I'm going to talk about, one is primarily optometric, which is the perennially thorny issue of explaining cataract to patients, and the second issue is one around dispensing. So if we start with cataract, again, we do just see a number of situations arising where customers become confused or aren't clear about the process for cataract referral. Now, I'm sure that most of you listening to this are really clear about your local referral criteria and guidelines, and please, if you're not, please make sure you are. It's really useful for us if practitioners are really clear of what the guidelines are and abiding by them. It really helps to remove some of the ambiguity, which I'm sure you can imagine occurs when patients often feel like they should have been referred a little bit quicker than they have been. So local referral guidelines and working to those and being very aware of them is hugely helpful. And once again with this situation, the quality of record keeping is absolutely critical. So, we've experienced cases here where, customers have been quite sure they should have been referred quicker than they had been. And because of the quality and the fantastic records by the practitioner, we've been able to reassure the patient that wasn't the case and that the appropriate action's been taken, and that has been hugely helpful. Conversely, of course, if we don't have that quality of record keeping and advice given, it can make the whole situation just become a little bit more difficult to resolve, and it can run out of control a little bit for the practitioner. So please be really clear about your advice. Be really well appraised of what the local criteria for referral are, and write it down. It really helps you, and it helps us to make sure that the issue doesn't spiral into anything other than an early stage complaint. The second issue I want to talk about is probably the issue we see most of at the OCCS, and that's the issue around dispensing of Varifocals. We're all aware that as the technology develops around Varifocals, they have become, much easier to wear and a fantastic product. But the sheer breadth of availability of Varifocals, there are about 600 different lens products on the UK market now, also brings its own complexities and challenges. So in terms of varifocal dispensing, we do need to be really clear about a number of issues. What are the kinds of things that we see that crop up? Well, certainly there's something around, if somebody's happy with a particular type of varifocal, be it a hard design or a soft design, unless there are compelling reasons to do so, it's probably sensible to keep people in the design of lens that they are comfortable with and have been happy with. That doesn't mean that we can't upgrade them, but of course it does really help to mitigate and minimise the chance of complexity. The other key issues are around the way in which we take varifocal measurements. Can we please check with our staff and make sure all of our colleagues are really disciplined around measuring for varifocals as accurately as they can be? Can we use pupillometers, make sure mono PDs and vertical heights are done accurately? It's really important that we use the tools that are available to make sure that the position and the dispensing of the specs is absolutely spot on. There's a great saying, my father-in-law was a joiner, and he used to say, measure twice and cut once. I think that's a great adage for dispensing varifocals, actually. Let's always have the measurements double checked. I think it will cut out a lot of the kind of issues that unfortunately find their way to us. And finally, on varifocal dispensing, if I can make one request, it's can we please make sure that we measure and dispense to a pantoscopic angle. There's no doubt in my mind that a number of the varifocal challenges that we come across emerge and emanate from the fact that we haven't had this measurement taken or hasn't been dispensed with. So please, my one request to you all is please measure and dispense varifocals using an appropriate pantoscopic angle. Thank you very much.